Lockdown mode now initiated.
So today we are on lockdown day 2 of the coronavirus, and we're on lockdown in the UK. This is the 24th of March 2020. We're going to go over a brief introduction in terms of the number of cases worldwide alongside the number of deaths worldwide, and then the same for the UK. So the two regions that we're primarily focusing on. So the total number of cases worldwide have reached a number of 372,755. The total number of deaths worldwide have reached a number of 16,231. The World Health Organization risk assessment level is deemed as very high. The total number of UK cases is 6,654, and the total number of UK deaths is 335. So obviously from the last few days, from yesterday, what's the sort of update that we've got at the moment then? I mean, what's the increase?
Right, so 4 new countries have contracted the coronavirus. So this is countries/territories, areas from the Southeast Asia region, and so that's one of the areas from the Southeast Asia region, and 3 regions of the Americas have reported cases of COVID-19. The WHO has delivered a new shipment of emergency medical supplies to the Islamic Republic of Iran as part of a COVID-19 response measure. The WhatsApp health alert that WHO set up has now attracted 10 million users since launching on Friday, and the COVID-19 Solidarity Response Fund has raised more than $70 million in just 10 days.
That's a substantial amount.
Yeah. WHO and FIFA have launched a campaign to equip the football community to tackle the COVID-19. This awareness campaign calls on all the people around the world to follow 5 key steps to stop the spread of the disease. And WHO and its partners are constantly working to strengthen the chains of essential COVID-19 supplies as global demand rises. WHO and its partners aim to ensure the assistance to most areas that are in need, the areas most in need.
Right.
In terms of the statistics that have gone up, so you've got the obviously, like you said, the grand total 372,755. It's risen in the last 24 hours by 39,825 cases global, and the total number of new deaths in the last 24 hours is 1,722.
Look, just looking at those numbers on their own that's a massive increase. I mean, 39,000 cases sprung up over the last 24 hours. Yeah. That's immense on its own, let alone the next, the figures about the deaths, 1,700 deaths in the last 24 hours. Again, I mean, I feel like the cases are just starting to pop up everywhere. The numbers are creeping up rapidly, especially looking at the European number of deaths as well, because they're rapidly increasing. So my question to the number of deaths, in terms of how it's so rapidly increasing, do you think that there's enough medical treatment out there for those sort of, for those numbers? Do you think there's enough people on the floor in every hospital to help manage those numbers effectively, or?
It's hard to say. I mean, you'd hope that there is, based on what the UK has been doing. You could assume the same of the rest of the world, asking the retirees or even the former health staff coming out of retirement in order to add to those numbers. In order to add to the human resources that they've got available, and then again with the student, the medical students also being fast tracked. You might have enough people to deal with the constant rise of cases that way, but as of yet, based on the situation that we've got with the obviously in the UK, I'm not sure how everybody else would be coping.
Exactly.
But that's partly to do with in the UK we have a lot less cases than say like Spain or Italy, France.
Exactly.
They've got a lot more, so perhaps they're not able to deal with it as well as we would be.
Exactly. Yeah. Do you reckon that the UK is like I've had quite a slow and sort of lagging approach in terms of the mass testing? Because a lot of European countries, as well as a lot of countries just around the world in general, have started to do mass testing really quickly. Do you think the UK has sort of slowly adapted to that because we're yet to see that over here?
I wouldn't say that it's adapted at all to it then. If we're still yet to do it. But there has been, in all fairness, at least we've got some of the stages going right now, in terms of, like the lockdown. But then, when it was announced on Friday, I was under the impression that the lockdown was beginning on Friday. Everyone was saying, "Oh, lockdowns today," but it actually took a few more days to actually come into effect, to be the outright lockdown. So I think even with the approach that we've got, it's almost as if we're being asked a bit too nicely to just stay inside. It should be more a case of you will stay inside or there will be consequences because this is a world health crisis. It's a pandemic and nobody wants to admit that.
Yeah. I mean, to be honest with you, I agree with what you're saying 100%. I just feel like people don't take the Prime Minister's word serious enough. Like maybe if it came from like a commanding police officer or a commanding army general, for example, it might have been taken a little bit more seriously just because of, the way people see Boris in whatever light they see him in. Do you know what I mean? I don't think people look at him as like, okay, that's the number one authority or whatever. I mean, even though he is at the moment, people don't take him serious enough. And due to that, we're obviously having cases where people are still not abiding the social distancing rule. So, for example, a story broke today from Sky News saying that there's aerial footage being taken of London where people are still going out shopping and are really not bothered about the social distancing stance that the government's taken.
Right. I mean, it's not surprising, given that people seem to act as if they're, invincible, or they look at it from the perspective of, oh, well, it's only, a minute percentage of people that are actually, that become part of a fatal statistic. But what people really need to do is to expect the worst case scenario. If it's happened to someone that has similar circumstances or has similar, attributes to you, shall we say, in terms of age and health conditions and, anything like that, then assume it will happen to you if you get it.
Yeah.
Because that way you're going to be a lot more sensible.
Exactly. I mean, just going off what you said just a minute ago about the fatal statistics, we've seen that over the last few days or so. We've all heard the story that a 21-year-old has died in the UK from coronavirus, and she had no pre-existing health conditions. So literally not a case of any sort of illness in the past, any serious illness for that matter. Do you think it's just down to a weak immune system, or whether it's, everybody's body just reacting differently to the virus in a sense? Do you know what I mean?
Yeah, I would say so, because even when you look at medicine, during drug trials, when they're testing new forms of treating illnesses, everybody that is part of that trial reacts differently. It's not like everybody has the same reaction and it's the perfect medicine. It's likewise with illnesses. Not everyone's going to have the same reaction. It will affect others worse than it will affect some worse than others. But when it comes to illnesses, as I said, everyone should just expect it to be the worst case scenario.
I mean, I entirely agree. It's just Michael Gove, obviously, made that video a little earlier on today as well, and that's come up on Sky News as well. That he's basically quoted saying, "Stay at home or lose your loved ones." Basically, get ready to lose them. And if that's the basic message that's been put out to the people out there, and it's so simple. It's just so simple. And Piers Morgan has also, posted his own take on it as well, saying how hard can it be to literally just turn your television on and stay at home. Do you know what I mean?
Exactly.
A lot of people complain. A lot of people complain when they're on their, regular working weeks and stuff. Oh, I don't have enough time to sit down and watch telly. I don't have enough time to do this. I'm never at home long enough, to carry out this or to do this. Now you've actually got that time to stay in the confines of your home and do whatever you want to do. Yet people are doing the total opposite. Do you reckon if the government almost used like a reverse psychological stance and said, go outside, go kill yourself? Do you reckon it would work?
Perhaps the message would, if it was delivered that bluntly, then maybe it would, actually, have the desired, effect. The point is, no one's going to live forever.
Exactly.
We're all going to die. So why are
That's
you
it.
in a rush? You're going to die anyway.
Exactly.
Why are you in such a rush to die?
Exactly. It's just absolutely astonishing to me that people can't just listen to basic instructions. Do you know what I mean? You could tell a child, sit down, stop doing this, put that down, and they'll listen the first time. When you're telling a grown adult, someone who is of understanding, and they're doing the total opposite, yet they're like, the risk is so high, it's a fatal risk, and they're still taking it as if it's nothing. Do you know what I mean? I don't know. It is ridiculous. I mean, we've seen so many parts of the UK where people are still going out. There's another story on BBC where the police have basically told people it's not a holiday. You shouldn't be sunbathing outside. You need to get your ass up and go home, basically. And it's a case of it's just panic around the world. It's a massive pandemic. It's a mass panic, and people are just thinking, it's not as serious as everybody's saying it is. There's thousands of people dying every 24 hours, and it's still not getting into their brains that we need to stay at home. I don't know what else can be done. Have you got any other thoughts or anything that like the government could do, or any plans that they could put in place to alleviate people from leaving their homes?
I think whatever is going on right now in terms of the lockdown and everything, have a presence on the streets that just that enforces that, or if need be, increase the the measures that are taken in order to keep people at home. But I've been saying it for a while, martial law, because that's like one of the top examples to just curb basically everything. It's getting to a point where people are almost taunting the government to take away the freedoms, and then they're going to be complaining after that, saying, oh well, why has the government done this? Why have they taken away our freedom? Now we can't go outside. It's like being in prison. But if it comes to that, it's because of the actions of people today. If that's what happens tomorrow, that is as a direct result of the people's action today. Stay at home. Only go out when you need to. Follow the direction that was given by the Prime Minister, and you'll keep your freedom. But I think that is what it'll end up boiling down to. I think the Prime Minister in the coming days will just say that I'm gonna put martial law into effect. No one's allowed out anymore. Or if you are allowed out, then you're gonna need like some kind of like permit card or something like that. There will be no groups of people. Anyone in groups will be arrested or something like that. I feel like that is what is gonna end up being said.
Yeah,
that any groups will just be arrested on site.
Yeah,
rather than dispersed.
To be honest, exactly. I mean, no, let's find out. Go for it. Just going off the back of what you said, then I feel like heavier sanctions should be put in place as a primary measure, and then after that, I think if people are still not listening after a 10-year prison sentence or a 5-year prison sentence it's been presented, and they're still not taking it on board that you have to stay at home, I feel like maybe then the ID system could come into play, and then possibly a military presence on the streets. I mean, we've got enough numbers in the military to put like a station in every major city almost. And I think that county lines should also be closed at the moment, so people can't pass into another county, and that will also help obviously cut down the numbers of people that are actually on the road. I know this myself because, like I was saying, I went from an essential worker at the beginning of my shift to a non-essential at the end of my shift, and now I'm literally at home the whole time. So when I was on the roads and stuff, I saw a lot of people out and about, just living life, taking it easy. Do you know what I mean? And I'm obviously observing this from my stance. I have to go to work as an essential worker. Once I'm done, there's no other place I'd rather be than go straight home, sort of thing. But there's still people out when I was leaving, and when I was going, there was people just walking around in town like it's just another day.
I mean, like I said, it's one of those things where people are just going to get their freedoms taken away from them if they don't
Yeah.
follow the rules that are already in place. You know, it's
Yeah.
simple. It's like when a child, like the example that you gave, you know, you tell a child to put something down or to stop doing that.
Yeah.
They're supposed to stop doing that. If they don't, there will be a punishment in place, and they're not gonna have that item anymore. You know,
Yeah.
or whatever it is that they were messing about with, or they're not, you know,
Yeah.
or they're going to be put somewhere where they don't, you know, where they're not able to do whatever it is that they were doing.
Yeah.
It's the same, you know, the principle is exactly the same. You know, do people want the freedoms taken away from them? No, absolutely not.
Yeah.
But you
Exactly.
know, but does that mean that because it might be your last day of freedom, go out and, you know, just go to chill out, or, you know, go and
Yeah.
socialize? No, because there's a pandemic. You know, there is a
Exactly.
disease that is killing people. Stay at home. You know, if
Yeah.
is there really anything bad about staying at home and getting paid 80% of your wage for it?
Yeah. Exactly. That's it. There's literally no need to go out for a thing, or for the mass public. There's no need. It's only the essential workers that need to be traveling to and from work. But obviously, with the number of businesses now obviously closing down either temporarily or permanently, people are still going out. I mean, McDonald's being one of the big ones that went from you know, sitting in service to drive-through only, and now drive-through only is being closed as well. So
Yeah.
I mean, if a business of that magnitude is closing its doors, you know, temporarily, I think that, you know, it should send a message to the wider public to say, look, even we're closing now. Why are you still out? Do you know what I mean? Like, I really think that businesses, like big businesses, could take on the responsibility of spreading that message. Like, please stay at home. You can order via our takeaway delivery service. A lot of, you know, businesses, small and big, are doing the delivery service where they'll literally take your items, your food, your shopping directly to your house, directly to your door, even, just like we were talking about the other day. I still think people are just not clued up enough. Do you know what I mean? I think there needs to be more information from these businesses sent out to the people so that they can actually understand, you know, that service is available for us.
But I think, you know, it's very true. But at the same time, sometimes the best way to learn isn't always, you know, isn't always the easy way. Sometimes, you know,
Yeah,
in order to
I
really
agree.
stick something in your head, you've got to learn the hard way. And
Yeah,
you know, you'll learn to stop playing with fire when you get burnt.
exactly.
And
That's an amazing analogy for it. Yeah, exactly.
and it's like, I don't like having to say this, but, you know, for some people it's going to be a case of they're only going to learn when they get the coronavirus
Yeah,
that they shouldn't go out.
yeah,
Like some
exactly.
people are just like that. No matter how much you tell them, you know, they won't listen until it actually happens,
Yeah,
and then they'll turn around and say, you know what, you were right. But, you know, by then
exactly.
it's too, you know, in most cases it's too late.
Yeah, exactly. I mean, you better hope that you've got a really good immune system if you get it, because if you've not listened to the instructions of the government and everybody else, there's nobody that can literally help you when you've got it. So it's just one of those cases where start listening, or like you said, put yourself at, put your life at risk, basically. I think we had another story of an 18-year-old that you picked up on earlier on. Do you want to just run us through it?
Right, okay. So, yeah. So, it was with an underlying health condition, but it is thought to be the youngest person in the UK to die of the coronavirus so far.
Right.
So it's just generally that as the story for the person who's died as a result of the virus, and then it just goes
Yeah.
into some of the statistics about what are the risks posed to different ages, and then, you know, individuals aren't the average, obviously, as we've you know, as
Yeah.
shown by the 18-year-old and then by the 21-year-old as well.
Exactly.
But it is known to play a role in people's you know, chances of surviving, or, you know, like statistics with underlying health conditions, regardless of age. So, for
Yeah.
example, if you've there asthma puts you at a higher risk of severe illness if you contract the coronavirus, and there's around 4.3 million adults in the UK that have asthma.
Right. That's a massive statistic. You know, looking at the amount of people that have the coronavirus at the moment, and potentially people that could pass it on to one of these 4.3 million people. Yeah, we're definitely looking at the numbers in the millions now. Just a few days ago we were saying what happens when the number reaches the million mark.
Yeah.
Do you know what I mean? It just becomes that much more serious in a sense. I mean, not that it's not serious, but when it hits the million mark, things start to change. And the procedures that we have in place should also start to change in line with that. Do you reckon, looking at the numbers that have looking at the numbers in terms of the European deaths and cases and so far, do you reckon that Europe should adopt the pop-up hospital that China have sort of adopted a little bit earlier? Do you reckon that they should start to implement this across Europe?
Yeah, absolutely. Anything that will allow more hospital beds, anything that will allow more accommodation. For the obviously the patients, not just of the coronavirus, because now the coronavirus patients will be filling up a lot of the beds, but you've got to remember that all of the other health conditions that were present before the coronavirus became a pandemic will also still be present today. It's not like they've just all hit the pause button.
Exactly.
So it's really going to divide the workload of the medical staff. It's just a question of whether the medical staff in the European countries have the numbers themselves in order to treat all the patients, because they've got the other European countries have a lot more cases of the coronavirus than we do. I mean, if you just look at Italy on its own, for example, it's like the central the hub for the coronavirus in Europe. It's 63,000 cases.
Wow.
But in the UK, we've only got a tenth of that.
Yeah.
But does Italy have 10 times the medical staff that we have? Probably not.
Exactly. Yeah. So, that's a good point.
So the ratio of medical staff to patients, and then in addition to the amount of pop-up hospitals that they set up, are they going to actually be able to make the same kind of use of the pop-up hospitals as China was able to?
That's a key question, to be fair. Looking at some more information, right? We've got the delay in reporting coronavirus incident at a ski resort. So basically, what's happened is there's a coronavirus incident at a ski resort, and the resort itself sort of delayed, reporting it to the authorities. So they're now looking at the ski resort and asking them, why did it take so long for you guys to actually let us know? Do you reckon that this has been the case elsewhere as well? Like, would companies be willing to go public if an employee had the virus, or would they just try and cycle them out of the company?
It depends. I mean, a lot of these companies do like to sort of keep the focus and keep the ball rolling in terms of like the process of the business, the income that they're generating, obviously closing down or announcing that an employee has the coronavirus and they're going to order them to self-isolate. It can harm the image of the business and thus obviously harm their potential income. So from that perspective, I feel like some might be inclined to just sort of do it in the background or delay the announcement as much as possible. But then at other times, perhaps they just want to make sure, they don't want to say, okay, it's the coronavirus, even though they haven't tested it, or they just jump into conclusions. But I think at this point, if anyone does display any symptoms that match the coronavirus, even if it's just a common cold, and the common cold is related to the coronavirus, they should just say, right, you've got to self-isolate. They should make it known, because the safety of people is more important than your monthly income.
Yeah, exactly.
If you've got no customers left alive as a result of the coronavirus, you're not going to have any business. So they're the
Absolutely.
priority, and even with the
Yeah,
staff, if you haven't got any staff left working for you, then you're not going to be able to serve any customers. So both work
exactly.
hand in hand. You need to prioritize their safety and the safety of people over the safety of your predicted income for this quarter.
Exactly. I think business owners and CEOs and people in that function need to be a lot less selfish, just like you've said, and focus on the safety and health and welfare of their employees. To be fair, because without employees, there is no business. Employees are the lifeblood of a business, just like customers. Without those guys, you'd be like, look at Amazon, for example. I'm not saying that they've done anything wrong in this time. I'm just giving them as an example. If without their supply chain, without their delivery network, without their without their warehouse workers and stuff like that, where would they be? Would they still be able to live up to the promise of a next day delivery or same day delivery? I doubt it. And if they weren't able to do that, that would seriously take them out of like the number one spot in terms of logistics and so forth. Do you know what I mean?
Yeah.
It would seriously harm their operations. But obviously, from what we've seen, even Amazon is starting to adopt a like a self-isolation process as well. So they're really looking out for their employees in that sense, which is good to see. That's what we should see. That's what we should be seeing. What about the supermarkets though? Because they're still steadily hiring people, obviously due to the surge of panic buying and stockpiling. So how does it compare for those guys?
I'm not sure. I think it's they might give everyone say like an aisle each or something, or like part of the obviously the aisle has two sides, but like one person gets the left side, one person gets the right side, and that's it. And it could just be stacking the shelves, and they only stack one side at a time. So once that person's done, then they'll say, okay, you step to one side, so you don't have two people in the aisle at the same time. Perhaps they're doing it like that, or we don't. Do you know the extent of the their shifts, their shift patterns, how long they're actually going to be there at work, or can you just give us, I don't know, say how many hours are they doing a day?
Yeah. So off the top of my head, the temporary workers, the people that are just coming in just for this next 12-week phase, they're going to be doing around 8 to 14 hours on average. So for example, average of that would probably be like 10 to 12 hours a week. Now that could either be split into one shift or two shifts, because if you're doing 12 hours, you can do 2 6 hours, or if you're doing like a 15-hour shift or a 16-hour shift, you could possibly do like a four and on like another 8-hour shift, for example. So it just depends. It depends on the store and what their needs are more locally. But I'd say around about 10 to 12 hours on average.
Right. So would it be possible that they only get called in for say 2 hours a day across the entire week? Just
I don't think so. I don't think so, because I think it'd be more of a case of the hours that they're given in the beginning. So it won't have like a 0-hour effect almost. Do you know what I mean? Like for example, Sports Direct, they're working with a 0-hour contract at the moment. So for example, they might call you in the morning and say, "Can you work today? We need 3 hours done today." And then they might call you the next day and say, "Look, we don't need any hours done today." Do you know what I mean? Whereas I think the way the supermarkets are doing them, are giving them fixed hours. It's like a fixed shift. I mean, it just gives the employee a little bit more security in knowing that they're getting paid a fixed amount rather than having a variable amount of hours worked every week.
No, I don't mean like a 0-hour contract. I meant more in like terms of, say if they're doing 12 hours a week and we say, okay, for 6 days of the week, we need you in for 2 hours just stacking the shelves, in the morning, making sure that everything's on the shop floor for the customers, like that. That's what I meant. Just in lines with obviously, if they have like a certain amount of people tending, certain aisles in the morning, that it makes sense to me to do it like that. But it's not the only method that is viable. That's the only reason I asked.
No, because I know what you mean, but I think in some cases they're giving them they're giving employees night shifts as well in some cases, so that they're sort of able to get the shelves ready for the next day. Do you know what I mean? So they'll get someone in. I've seen a shift online, and I think it's at Tesco. So a shift from 10 to 7 in the morning, and it's just like one shift a week. But basically, the employee obviously would go in, and whatever whatever aisles they're given, they've got to make sure it's stacked to the back. Basically, there's enough products given the next day, and then it's just a repetitive thing. So one day a week, the employee goes in and just completes the same task, basically.
Yeah. It's just kind of puzzling at the same time in terms of how many hours and how many employees that they'll have. How close will they be? Like what you were asking, like what's it going to mean for the employees? Everybody else is supposed to keep such a distance. It's just something I'd have to see. Just to have a look at, and then upon observation, obviously we'd have a better idea.
Exactly. One thing I wanted to sort of pick up on as well is going towards the back end of March now and towards the beginning of April. Every financial business year starts in April. So we know that the budgets are getting tighter and tighter as we go towards April. How does that now compare to hiring more people into these sectors now? Because where obviously the government is now providing the funding for it, and it's only for a certain amount of time, so it's a temporary position. But what happens, for example, if the virus gets 10 times worse? I mean, will there be a surge in employing new people into the business, and will the whole financial business sort of aspect of a tighter budget just be abolished altogether?
I think if the situation got 10 times worse, I think jobs would pretty much cease. Money as it is now, like the economy, I think would have to be put on hold.
Yeah.
I think it'd go to ration cards or something like that. Everyone would have to everyone would just have to stay indoors then. It probably would end up being martial law. I'm not even sure they'd risk the anybody being out on the streets to enforce it. I think everyone just would stay inside.
Yeah.
But then at the same time, it's how do you keep the infrastructure going? If it does end up getting so much worse.
Yeah, exactly.
You'd have to switch to like renewable energy supplies. That so it doesn't cost money to actually generate the power. When it comes to the emergency services, they're going to need some sort of support. You can't. It's not as simple as just printing more money. That's the unfortunate thing. You need the gold in the bank in order to back up the money that you've got. Otherwise, the value of whichever country's currency, it will just fall through the floor.
Exactly. Hyperinflation, just like the case in Germany.
Yeah, just overnight, one egg will go to like £4 billion. It's not good. No one's going to be able to afford it then. And that is the reality of what happened in Germany after World War One. But I did actually hear that 200 billion was going to be printed in order to support this. In order to support the government loans, to pay for the wages as well. It'll bring down the value of the pound if that is true. I haven't actually verified. I haven't looked online to see if it's true or not. But it's a really bad idea if it's true.
I hope so. I hope it doesn't get added into the circulation, because exactly, the value of the current currency will obviously decrease. Looking at sort of a summary then, in terms of advice, I mean, the advice part of the podcast that we normally give people. Is it just the same as always? We tell them to, stay at home, stay with your loved ones, look after your vulnerable, look after the vulnerable members of your family, look after the vulnerable members of the public that are around you, and just sort of, try to adopt a healthy home life. Well, it's not going to be work anymore, but try to adopt a healthy sort of balance in terms of your life being at home. What would you recommend?
I'd recommend to look at the sort of hidden blessings of the coronavirus. A lot of people have been at work and they've not had the time to spend with the family. Now you've got that time. Say you've never had the time to work out. You'll go to the gym. You can work out at home. Press ups, sit ups. All sorts of things. there's, even if it was just to, clean up your house, clean up your living space, you've got the opportunity to do it now. There are a great number of hidden blessings. I mean, for religious people, you're away from distraction. It's you can get closer to God. So
exactly.
there's good things that come from it. And like I said in one of the previous episodes, I can't remember which one it is, but just focus on the positives of what it's done for the world. I mean, you look at the environment itself. You can there were actually quite a few stories covering this on the news, that the pollution in China. How there's that smog and everyone because of the usage of coal. A lot of that is cleared up, if not all of it. And it's just a lot, all over the world, the environment is actually being able to recover, like the ozone layer and, the kind of pollution that was there previously months ago is no longer there.
Yeah.
So it's good for the planet. And it also, it presents a chance to use renewable energy. I'm not saying, everyone has to go green, but, it's one of those things like now would be a good time to implement things like solar panels, more so than what the previous amount was, even with fuel, alternative fuel options for cars, rather than just hybrids or petrol and diesel. There's a lot of good that can come from the coronavirus, just in terms of the values that people have. So I think people should look for those the good things that come from it, and they should sort of build themselves based on that.
Absolutely. What I will do as well is, remember we talked about how they can access courses and free online programs to help empower and upskill themselves. I've also found the website that I was looking for. So I've also found that link, and I'll attach that link to the video in the description, as well as all the other stories and updates that we've given you today. I'll attach all the links in the bio so that you guys can go there, click it, and get updates in real time